Brett Schaefer, I want to show you a tweet or read a tweet from President Trump. This is less than 2 months ago, and he said that the coronavirus is very much under control in the USA. We are in contact with everyone in all relevant countries. CDC and World Health have been working hard and very smart. Stock market's starting to look good, very good to me. What went wrong, do you think? I mean, you talked about the issue with the information from Taiwan, but WHO seemed to fall out of favor quickly with the president.
Well, I think we're sort of dealing with the ramifications of both the World Health Organization's credulousness and China's lack of transparency. Based on the information that China was saying in December, the outbreak was very small. China was saying that there was no evidence of human-to-human transmission. They didn't even tell the World Health Organization about the disease until December 31st, and that was weeks after they knew that that there were cases that were erupting in Wuhan and that there was evidence of human-to-human transmission. They refused to tell that and share that information with the broader international community. The World Health Organization on January 14th tweeted out that there was no evidence of human-to-human transmission, despite the fact that China knew that there was. So what the president was basing his comments on at that point was the information available. And the information available was obviously false because China was not being transparent. Now, we know very much better that China was not being truthful in this. And I think that if the world community had known that this was a very significant disease, a very deadly disease, and one that was very contagious in the late part of December, I think the response from other countries and the United States would have been very different.
Do you think that the World Health Organization will, in the coming weeks and months, be more forthcoming about that data?
I think that they're going to have to be, because I think that even though the United States has been out in the forefront demanding an investigation and demanding access to information about what the World Health Organization knew and how complicit it was in helping China not tell the truth about this matter, I think that other countries themselves are going to increasingly demand that information as well, as their deaths mount, as the economic cost of this disease mounts, not just in Europe and the United States and other developed countries, which we've been seen in reporting, but it's now starting to surge in places like Africa and Latin America, and they're going to be dealing with this disease themselves, and they're going to want explanations as well.
We have several calls waiting, but I did want to play the response from Dr. Tedros, the WHO Director General, to the President's decision. Here's what Dr. Tedros said to that.
The United States of America has been a long-standing and generous friend to WHO, and we hope it will continue to be so. We regret the decision of the President of the United States to order a hold in funding to the World Health Organization. With support from the people and government of the United States, WHO works to improve the health of many of the world's poorest and most vulnerable people. WHO is not only fighting COVID-19, we're also working to address polio, measles, malaria, Ebola, HIV, tuberculosis, malnutrition, cancer, diabetes, mental health, and many other diseases and conditions. We also work with countries to strengthen health systems and improve access to life-saving health services. WHO is reviewing the impact of our work of any withdrawal of U.S. funding, and will work with our partners to fill any financial gaps we face and to ensure our work continues uninterrupted. Our commitment to public health, science, and to serving all the people of the world without fear or favor remains absolute. Our mission and mandate are to work with all nations equally, without regard to size of their populations or economies. COVID-19 does not discriminate between rich nations and poor, large nations and small. It does not discriminate between nationalities, ethnicities, or ideologies. Neither do we. This is a time for all of us to be united in our common struggle against a common threat.
And Brett Schaefer with the Heritage Foundation, what did you hear there in the comments from the Director General?
There's a lot to agree with, but there's also a lot to disagree with. And what I noticed in particular is that he did not take responsibility for his own organization's missteps in the early part of this disease. But also, he started listing off a number of things that the World Health Organization does. And I think it's a legitimate question to ask, is the World Health Organization spending too many resources on a number of things that it really shouldn't be doing? I took a look at the World Health Organization's broader budget, and it looks like about only 15% of the World Health Organization's resources go to actually combating pandemics, detecting pandemics, or preparing countries to deal with pandemics. The rest of the organization's resources go to overhead. They go to things like violence and injuries and road safety. They go to things like equity, social determinants, gender equality, and human rights, reproductive, maternal, newborn child and adolescent health, mental health, and substance abuse. Now, these things are all health issues, but are they really a threat to international health? Are they a threat to go across borders? Or are they issues largely of domestic concern? And should they be on the World Health Organization's radar and consuming so much of its time and resources? Instead, I would argue that the organization should be focused predominantly on the threat of pandemics, the threat of communicable diseases, and those things, those international threats that can actually spread from one country to another, and helping equip countries to combat that.